Hello, I'm Dr. Bruce Malone. I'm an orthopedic surgeon in Austin, and I specialize in major joint reconstructions, many of which are hips. My job is basically to restore function and decrease pain. Hip pain can be very disabling. It is a major problem to walk with any serious hip pain or inflammation. The hip pain is primarily wear and tear arthritis. There are a few people who have a form of rheumatoid arthritis, which is a systemic form of arthritis. Others who are younger can have a disease called osteonecrosis or avascular necrosis, where the blood supply to the bone of their hip is interrupted and they develop a very painful arthritis. And of course, we have a significant number of people who've had serious injuries to their hip and then develop arthritis related to those. So there are many reasons why you can develop hip pain, but it's very disabling. Many times it'll keep you from sleeping at night. The pain is primarily in the groin. Most people come in and say, it's my hip, and they reach back and touch their buttock area, but that mostly is coming from the back. So the hip pain is primarily groin and lateral pain that's severe when you walk. Well, this is the skeleton which everyone recognizes. Of course, my special procedures tend to involve the hip joint here, the knee joint here, and the shoulder joint here. I take care of fractures of the joints. I take care of joint reconstructions when the joint wears out from arthritis, and we replace it with an artificial surface that's a steel or ceramic ball, a metal socket lined with either a plastic type device or metal itself or ceramic. So we have lots of options and lots of new technology. The incisions tend to be smaller than in the past, and since I've been doing this for 34 years, I've been through all of the phases. When I was a young resident studying orthopedics, the first cement was released to do artificial joints. So we were doing artificial joints in the university when I was training, when other people outside couldn't use the cement and couldn't do it. There's been an amazing development in technology. I think orthopedics has probably been as amazing as any other specialty, except for maybe heart technology in the last 20 years. And let's face it, we just have cool tools. I mean, you know, we have lots of fun tools to work with. So we take care of patients who are both injured and who have chronic diseases, and the fractures are also a major source of the things we do. I just got through this morning replacing a knee joint and fixing a fracture of the humerus that needed stabilization. So that tells you about the variety of things we do. Well, I think the most common hip procedure I do is replacement of the joint, since I specialize in that. The second most common hip procedure I do is fixation of fractures. The fractured hip is a common problem in older adults who fall, and there are two types. One, we replace the broken ball with an artificial ball, and the other, we fix the broken crook of the hip, called the trochanter, with a special device, either a compression hip screw or what we call an intramedullary nail. So those are the two most common things we do with the hip. We've had lots of changes in the last 20 years in ability to do the operations through smaller incisions by developing instruments to do that. Right now and throughout the history of joint replacements, our big emphasis has been on the materials we use. And we're trying to find better materials that'll last longer. But when you have that and you're dealing with human beings, you have to be very careful. So I think there'll be changing technologies and materials, maybe more ceramics. We hope that we can eventually find procedures that we can inject into the joint and use cell technology to help regenerate cartilage. If you've heard that that occurs right now, that's wrong. We can't do that. And people who are advertising stem cell treatments of joints are kind of misleading. But the fact is, lots of people are working on it, and I think that's probably the most exciting frontier in the future. There are several things that help with joint health. Number one is avoiding major injuries that actually damage the surface of the joint. and those things can or cannot be avoided depending on what you do. Be realistic. If you've got a joint that's got a problem, exposing it to severe exercise is not going to help the joint. It's probably going to hurt it. Joints like to have normal soft tissue around them. They have a little bit of lubrication in the joint. There's lubrication that's naturally there, and so when you take it through a full range of motion, you lubricate and nourish the joint. The majority of the cartilage in the joint is nourished only by the joint fluid. It doesn't have a blood supply. Cartilage doesn't have a blood supply except at the very base, and that's the secret. That's why it's harder to repair once it gets damaged. Things that don't have blood supplies have a hard time healing. Of course, the common problem of weight control, and that's hard for all of us, including myself. So that's an important part. There's no question that excessive weight causes excessive wear. And then finally, just keep moving. Even if you've got an arthritic joint, having some regular exercise that you go through that moves the joint through a full range of motion, it improves the health of the joint.